Hi everyone, my name is Kira Miller and I did my health disparities report on maternal leave. I focused on rural Montana, but then also kind of had to take into account the US's policies on maternal leave as well, just because it's such a diverse topic and um, has a lot of issues, not just on a state level, but at a federal level. So I did have to incorporate just a little bit of what this looks like as a national policy, not just as a state policy for like within rural communities, just because maternal leave is affecting more than just Montana. So I looked at not only the absence that state and federal policies have of mandated maternal leave, but also how without mandated maternal leave, maternal health care for the mother and the child are actually running really high risks of negative health outcomes, such as increased stress, decreased amounts of breastfeeding, low birth rate, infant mortality, and maternal mortality, increased risk of postpartum, my bad, or inability to make healthcare appointments for either the mother or the child because they can't take time off work. So they choose to work instead of make these healthcare appointments. I started assessing foreign policies to show the benefits as to why the US should probably start providing paid maternal leave and implementing a move towards a more exclusive public policy for the care of families in general instead of just mothers, because families are more exclusive these days. So don't want to leave them out of the benefits, if any, that exist within the US, which there isn't much. And taking a step further into looking and thinking about what mandated maternal leave would look like for mothers in rural communities and the needs they have there. So I think it's important to let you guys know right off the bat that the US is the only first world country that actually doesn't offer paid maternal leave of any kind, and doesn't have mandated law or policy as towards what mandated just maternal care looks like. So that, like I said before, runs a high risk of mothers and infants for a lot of negative health outcomes, which makes this health disparities topic a pretty important one to start talking about. I did look at Montana's healthcare policy, and they have the right to maternal leave based off the Family Medical Leave Act, which states that all healthcare workers have access to time off, unpaid work. But unfortunately, most people don't take that because they have to work and able to afford the newborn they just had. So, that's it just doesn't really help in any way, shape, or form. Other than if you didn't get unpaid, you are legally protected. And then I started interviewing some mothers up on the Highline on Highway 2, which is known by locals as the Highline, which is a lot of really small rural farming communities. And a lot of the mothers expressed the stress for travel, and childcare was a big one for them. So I have sections in my paper talking about childcare and distance that just go pretty in depth as to how these mothers are struggling. So that was maternal leave from a rural perspective. And then my second topic that I looked at was maternal health. And one of the main things that stood out in the literature was how, by not having maternal leave, maternal health, specifically postpartum, really is affected by these policies. by not having anything to support these new mothers. I also looked at just existing like assessments as to like the risks that are in place for maternal health. And Montana actually had fairly like decent percentages when looking at like intended pregnancies versus unintended. About 86% actually participate in prenatal care during the first trimester and so forth, which is pretty good statistics, I think. And 90% actually do postpartum checkups within Montana, even though only 12.5 report they have self-reported symptoms. So while those are like really positive, I feel like there's still like policies that Montana and the federal government are failing to provide these mothers, again, specifically just paid maternal leave. Because when comparing to like foreign policies, like Sweden offers, I believe, 480 days paid paternal or parental leave. So that's 480 days split between 50-50 the mother and the father. And Sweden actually also offers 100 days of 80% salary paid sick days to make sure that mothers and parents or whoever can make sure that they can take their kid to doctor's appointments and stay at home with a kid who's sick. And they also offer preschool and childcare for parents. And if you have a child under the age of 8, they actually offer 25% reduced hours, which just guarantees that the parent can be home to make sure that a kid can get dropped off to school or picked up, which I thought was really progressive for these countries and definitely something that we can consider implementing here in the US. And my thoughts were possibly using these foreign policies and existing literature within the US to possibly start implementing like a 15 paid day or 15 day paid maternity leave, just to hopefully get our foot in the door to help decrease these negative outcomes that come from the lack of maternal leave in Montana.